Benzodiazepines, safety concerns, and emergency treatment. While benzodiazepines can be very helpful for treating anxiety and other disorders, they can become very easily addictive with unsafe consequences and should be used with great care under the supervision of a healthcare provider. Some long-term consequences of using benzodiazepines include anorexia, headaches, having problem with your memory, insomnia, anxiety, and tremors. You can also build up a tolerance to benzodiazepines and require a higher dose to get the same high or feeling. Withdrawal from benzodiazepines can also be life-threatening. Signs and symptoms to look for in someone who is abusing benzodiazepines are weakness, blurred vision, drowsiness, poor judgment or thinking, changes in mood or behavior, and slurred speech. A benzodiazepine overdose is serious and can be life-threatening. Respiratory depression can also occur, but usually only happens if there were other drugs taken, such as opioids or alcohol, or if the person took a very large amount of benzodiazepines. Signs of respiratory depression include shortness of breath and slow and shallow breathing. Someone who is suffering from a benzodiazepine overdose oftentimes shows normal vital signs and is usually awake and cautious enough to talk to medical professionals. If you suspect that you or someone you know is experiencing a benzodiazepine overdose or needs emergency treatment, call 911 immediately. Most patients are awake and coherent enough to inform the medical staff team what medication they took so that treatment can be tailored. There is an antidote that can be given in an overdose situation called flumazenil. However, the risks often outweigh the benefits, and it's only used in a case-by-case basis after careful consideration. Commonly, the patient is closely monitored and given IV fluids, and their stomach can be pumped as well. Mechanical ventilation and intubation is sometimes required in patients that show signs and symptoms of respiratory depression. It is important to note that it is not recommended to induce vomiting in overdose situations. Alcohol works in a similar way as benzodiazepines, so mixing them together can enhance the effect of each drug, which increases the risk of overdose since they both depress the central nervous system. In 17% of cases where opioid overdose led to death, benzodiazepines were also used, as they both cause depressed breathing and enhance sedation.